The Ministry of Health has reported that among the 49 individuals who have recovered from the Marburg virus, some have completed the surveillance program after testing negative for the virus, even in areas where it can persist in the body for an extended period. However, the ministry urges the public not to be complacent as the virus is still active. We have more with Enora Gladys.
The Ministry of Health reports that there have been no deaths from Marburg disease in the past month. Currently, there are 66 confirmed Marburg patients. 15 have died, 14 have recovered, and 2 are being treated in good health, with no one in intensive care. The Minister of Health, Dr. Nsanzimana, emphasizes that the public should not become complacent, as the virus is highly contagious and can severely impact those who contract it.
Overall, the case fatality rate is 22.7%. You remember when this outbreak started, the first thing everyone was talking about is 90% case fatality rate. The probability of dying from this virus is 90%. From previous outbreaks, really has been quite high. But this case fatality rate of 22.7% in our context is, I would say good news, although these are people we lost, but it could have been worse. Even with the best care we had, even with the tools we had, could have been. We also appreciate everyone's contribution to reduce the mortality of this disease. So that is a highlight. And again, the 2 cases I mentioned of those who got extubated is another confirmation that these 2 people could have died if extra efforts and the most advanced critical care hadn't been applied.
Minister Nsanzimana also explains that there are ongoing activities to monitor those who have recovered from this disease because there are parts of the body where it may not be entirely cleared from the body and could persist for an extended period. He notes that monitoring is essential since if not done well, it could become a source of its spread.
Because this virus is very complex. Sometimes you may see that a small amount of virus can remain hidden in some parts of the body, and that it may be different from one person to another. So we'll keep following these recovered individuals for some time. We gave ourselves a special follow-up. They will be receiving different type of testing, especially we know that, for example, in semen for men, a virus can remain in semen for several months, even after they have cleared the virus in their blood. So we'll keep testing them to make sure that they have recovered completely and there's no even small amount of viruses present, because otherwise they can reactivate and even infect or restart the outbreak. So it's very important to mention this to you, that although we have this number of recovered people, we'll keep following up on them for several months.
The Ministry of Health has reported that among the 49 individuals who have recovered from Marburg, some have completed the surveillance program after testing negative for the virus, even in areas where it can persist in the body for an extended period. The ministry also detailed that the first Marburg case in Rwanda involved a minor who contracted the virus from a bat. He subsequently infected his wife, who tragically succumbed to the virus. In response, a team of doctors have been deployed to monitor the health of workers daily, and similar measures are being implemented in other mines where bats are present. To mitigate the risk, a wall has been constructed in the mine to separate the working area from bats' habitat. The ministry cautioned against killing bats as they play a vital role in controlling diseases spread by mosquitoes and other insects, as well as being essential for agricultural pollination. So far, 1,700 people in Rwanda have been vaccinated against the Marburg virus.